I'd like to call our second committee of the whole to order today. First item is roll. We have all council members present with the exception of John DeBari. Is that correct? That looks to be correct. We do not have minutes to approve. Is there any public comment on items not on our agenda? Seeing none, we have one regular agenda item for today. Welcome, Vanessa. I want to turn this over to Julie for introduction, and I also want to thank Julie. To say she has put substantial work into making this happen today would be the understatement of the afternoon. So thank you, and Julie, the floor is yours.
Well, good afternoon. Thanks for staying late today, everybody. I came across a TED Talk Vanessa had done about quantifying the cost of homelessness and why it was fiscally irresponsible for cities to not address the issue with a housing first policy, and thought that that is would be a good part of the discussion that we've been having for the last couple of years. We obviously have a new housing and economic development department that's working very hard to put a plan into process and make sure that we are on the right track and not wasting money. So this will turn the discussion around. Well, what Vanessa's going to talk about today will turn the discussion to a point where we're data-driven and math-driven, and that we all understand the ethical and moral cost of having people on the street. What this will help us do is to wrap our heads around the fact that it is actually cheaper for us to house everybody and take care of our neighbors. I love Missoula because Missoula does take care of our neighbors, and we do care, and we put our compassion into practice. I think we're losing the battle on a couple fronts, and I think it's important that we refocus on those fronts, and this is the business practice and the math behind that concept. And she's very eloquent and very smart, and I encourage everybody to ask questions throughout the presentation instead of waiting. And at some point, if this goes on for very long, we will all recess and take a little break here and there, and Brian has agreed to make sure that we're not all falling asleep. But please ask her questions. The data she's going to give us today is primarily data from Boise, only because we're not able to get the exact numbers and data yet here, but Aaron's department is working on that very diligently. The data is extremely similar, I'd say within 5 to 10% of the cost. So the numbers she's going to give you today are representative of the cost savings, and they are significant. And I think there's going to be some raised eyebrows in this room when you hear the numbers. So I will let Vanessa take it from here.
Great, thank you for...
Just give it's very light.
There we go, yeah. Okay. Well, thank you all for having me today. Thank you, Councilmember Julie, for inviting me to come. I know this is how it works, but I hate having my back to you all. So if there is a question from the audience, please call my attention to it. I really want this to be interactive, so I'm going to be presenting a lot of information and data, but we can have a discussion as we go along. So, and so I just wanted to give you background on, why am I here and speaking with you about this. Well, a couple of years ago, the city of Boise was in a crisis when it came to homelessness. We had an encampment that the mayor ended up having to call an emergency action to take care of. And while that was going on, I had been hired to do a feasibility study to use an innovative public financing mechanism, which I'll talk about later. It's called Pay for Success. To raise capital to address homelessness in Ada County and the city of Boise. And so that was in 2015 when I kind of started doing that research, and these are all my project partners that have helped fund my research or supported me in some way or another, so I just need to reach out and thank them, and particularly at the time it was the White House Social Innovation Fund. And so I had a lot of experts at the federal level that were looking over the data to make sure that I was crunching the numbers properly, and a lot of partnership with the University of Utah, which is where Sorensen Impact Center is. So, and since then, I've really been digging into the issues regarding chronic homelessness in the city of Boise, but that's not, my background is not in social services. And so I'm more of a number cruncher. I have my MBA in sustainable management from Presidio Graduate School. And that school focuses on sustainability, looking at not only environmental sustainability, but social equity and economics. And so when I started, I got my MBA there and I started teaching there in '07. And that whole entire time and since then, I've been really interested in how we can better use our very few resources we have in the public sector, right? What are we doing with our resources? How are we allocating them? And how can we do better than we've been doing? And so that's why the city ended up coming to me and saying, hey, can you help us understand this? We've been looking at it from the social sector side, but what if we looked at it with more of a financial lens? So I'm going to go through some stuff with the city of Missoula that you know about, and then present some numbers that are based on the experiences in Boise, but based on the numbers of a project to address issues related to chronic homelessness here in Missoula with 25 people. But you'll see that. So we'll just move along here. So this is, so the 2017 Community Health Assessment for Missoula had year rental vacancy rate at 2.9%, which is actually exactly what it is in city of Boise. So, which means we basically don't have any rental homes, right? So we all know that's what that means. And we're, both Boise and Missoula are well below the national average, and so we're kind of suffering a little bit more than other places are. Every year, and you all are just wrapping it up here, and we're starting it today, communities across the country conduct a point-in-time count, which we all know is just a snapshot in time of people we can to survey and find that are experiencing homelessness. So your 2017 count had 344 total homeless people identified. 302 of them were just homeless was the qualification, but 42 of the 344 were chronically homeless. And so those are people that had been experiencing homelessness for a year or more and also had some sort of disabling condition, which could be a mental health condition, a substance misuse issue. And I'll kind of get into that a little bit more. So about 12% of your overall homeless population is chronically homeless, but just as it is in our community, you're chronically homeless. The people that are experiencing chronic homelessness here in Missoula are also using the majority of your community's resources to address issues related to homelessness. And so I don't have a bullseye in here, but let's picture a big bullseye on the front board here and think about targeting in on the issue. And so this is when I start thinking about how we can use our scarce resources more effectively. If we can target the way we use our resources better, then we know we can address specific issues related to the target, right? So if we think of our whole community and we say, we want to use our resources to make our whole community better, that's kind of obscure, right? But then we can start thinking about, we want to really target our resources to people that are in some sort of housing crisis, housing instability. And we can target it on it more and say, we really want to look at people that are experiencing homelessness. And what I'm doing here is I'm taking that target in a little bit more and saying, I'm going to focus in on those people that are experiencing chronic homelessness. And we know that those are some of the most vulnerable people in our community. And as I just said, they're using the vast majority of the resources we have available. And this presentation talks a lot about numbers, but I want us all to recognize these are people, right? So we talk in the aggregate, we talk in the average. We need to recognize that even though we're targeting in, we can target in further to the individual. And if only we have the resources to help Vanessa Fry every day on a daily basis for my needs, right? So that's the idea of trying to target in, but I want to kind of give you a snapshot of what someone's experience actually is. And so this is not his picture, nor is it his name, but this is his story. And the name I use is Joe, and Joe could very well be in your community too. And so when I was doing my research in Boise, I was saying that I didn't have any experience with homelessness at all. I can tell you I've done a lot of work in San Francisco, and until I started really working with the community of people experiencing homelessness, honestly, I was afraid. I didn't know what their life was like. I didn't know what their experiences were. I was hesitant to interact with them. And then when I had a reason to, through my research, I really got to know some people. And so it's, for me as an academic and as a researcher, and as someone that's trying to support good policy decisions, I think it's really important for us to think about the individuals we're affecting with the decisions we make. And so this is Joe, again, not his real picture nor his real name. And I met him while I was doing my research. And Joe was in his mid-40s. And for nearly his entire adult life, he'd been experiencing homelessness. And he also was suffering from mental illness and from severe substance misuse issues. And so Joe's life was hard, right? And it wasn't just hard on him, it was also hard on the community financially. And so Joe, as I was saying, he's homeless, and his main addiction was to alcohol, and he had no income. And so what he did to get his fix was he would break into porta potties and public restrooms and steal hand sanitizer and consume it. And it's super toxic, right? So like it says right on there, do not drink this. So what Joe was experiencing like very, very frequently was the need for to call 911. Someone would either see him having some sort of reaction, or he would get to the emergency department in a number of ways. And so it was a huge, huge issue. And so when after I started talking with Joe and our community partners built some trust with him, we asked him, do you mind if we kind of take a really detailed look into your life to see what your experiences are? Can you give us a data release so we can see what's going on? And he wanted help. And he said, yeah, if this is going to help you, help me, I'm more than happy to consent to release my data. And so first we looked at the emergency medical side of things. And again, like the costs that we experience in Boise are very similar to your costs here. So these are kind of comparable if Joe is here in your community. I'm sure there are people like Joe here. So this is just a 6-month period of time. He was transported by the EMTs 11 times, and he had 13 visits to one hospital. We're pretty sure he was at the other, but he may have been using a different name. They couldn't find him in their records, but we know he was in the hospital at least 13 times. And then because he was trespassing and he'd often be in places he shouldn't have been after dark, he also had quite a few interactions with the criminal justice system. None of them were violent interaction. The cause of his interactions weren't violent, so it was usually stealing or trespassing. And so he was arrested 14 times. He had 22 charges against him. And then in that 6-month period of time, he'd also been in jail 95 days. So this is just one individual over a 6-month period of time, and the direct cost that the community was able to attribute to his homelessness and the issues related to his homelessness was over $50,000. And so, obviously it'd be $108,000 if we would look at it over the course of a year. And, this is just one person. And here in Missoula, you have, just under 50 people experiencing chronic homelessness. And so, what is chronic homelessness all about? So I was saying it's been someone that's been homeless for a year or more and also has some sort of disabling condition. And that could be a mental health condition. It could be substance misuse. A lot of chronically homeless people have some sort of dual diagnosis. And so they have, like Joe did, a mental health issue and a substance abuse issue or some other issue. And they're the highest users of social services in our communities, right? So if we targeted on these individuals. When I started doing this research in Ada County, and I started trying to figure out the touch points, I started off doing these informal interviews with people like Joe to figure out where are these people really touching the system? Because I had to get a sense of where's that happening. I found there's kind of 3 main buckets, and so it was the emergency shelter system, the emergency system for medical uses, and then also the criminal justice system. And I was really looking at the reactive services. So how is the community reacting to his homelessness? There wasn't a lot of prevention going on. And so here's the issue, which, this is why I'm here today. We recognize that people like Joe, not not exclusive to Boise, not exclusive to Missoula, but all over the country, are costing our taxpayers quite a bit of money. And what I found in my research, like I was saying, in Boise, and every community is different. But if I looked at the research across the country, what we see was going on with homelessness is there's a lot of reaction to it and not a lot of prevention against it, just because we don't have a lot of resources. And so our scarce resources have been put in play in a way that is reacting to what's happening. So, right, we have poverty. People become homeless. They are addicted to drugs, whether it's opioids or otherwise. And we react, right? We react by sending them to the emergency room. We react by interacting with them in a way that they get in trouble because they have a misdemeanor, and so they get engaged in the criminal justice system, which is really hard to get out of once you're in it, right? You can't, you get a fine and you can't pay it. You can't show up to court because you don't have transportation, right? And so there are these issues that keep on happening. And so then we keep putting more and more money on the reactive side. But, what if we put our money on more of the preventive side, right? We've all heard this: an ounce of prevention is worth a pound of cure. And the way that social services are structured, and this is a broad statement, but the way social service system is structured in the United States is a very reactive system. So, and there's a number of things we can look at, whether it's from education or homelessness or even asthma, right? We're reacting to these symptoms that are out there instead of preventing them. But what would happen if we reallocated our resources in a way that we could have more of a preventive approach to some of these issues? And so that's kind of where that's what I'm really interested in. We don't have that many resources. How can we actually use them better and make those resources go further? How can we be more fiscally responsible with the little money we have, right? And so this is a professor at Duke, and he really is pitching this idea of these market-based solutions, right? We should think about investing in our community and expecting a return on that investment for any program. We should expect outcomes, not just outputs. So an output would be in the homeless shelter or in the jail, number of heads and beds, right? That's not getting us to where we want to be. If where we want to be is housing people, we should really look at the long-term outcomes that we want for these different social issues. And so Greg Dees talks about thinking about it in a market-based approach. So it all sounds very dire, right? Oh my gosh, we're being reactive. We don't have very much money. What do we do? And I always think, well, gosh, if everything was perfect, it wouldn't be that much fun, right? So we have an opportunity here to really change things. It's not just a problem. It's an opportunity for us to streamline what we're doing and to serve our communities in a better way. And so what I'm going to show you next are these are very rough estimates, as Julie said, of what the costs would be for 25 people experiencing chronic homelessness here in Missoula. This is based on numbers that Aaron shared with me that the city has, and then based on numbers we have in Boise, and so I kind of cross-referenced them. And so if we look at here, and on the next slide, it's got the total cost, but when I think about the cost, like I was saying, I break it down into a couple categories. So there's the shelter system, the criminal justice system, and kind of the medical system. And in medical, I think of both mental health as well as physical health. And so you can see the vast majority, the one with the biggest chunk, are the medical costs. So, and here I actually have mental health services separated out from the physical services. So, $870,000 there in medical costs, and so that's a lot of money being spent. And these are actually, I should say, these aren't charges, which are different than costs. These are based on costs. So, and depending on the community and the way that the medical system is set up, it's going to break out differently. But when I started working with our hospital systems, it was clear we needed to be looking at what the actual costs are to the system and not the charges that someone can leverage for an emergency room visit.
Gwen.
I have an interactive question.
Yeah.
So I understand the analysis on how you get to some of these numbers, but for example, I'm looking at policing and legal. I mean, we have a judge that we pay a salary. Yep. We have all of these. Those are hard costs that aren't going to change whether she sees 30 cases or 15 cases, and police also. But How do you get at these numbers?
Yeah,
Really,
no,
I don't understand.
That's a really good question. So there's fixed costs that we're going to have, and that's going to be the judge's salary, and there's going to be variable costs. And so what we tried to do for this research was looking at the variable costs and some of the cost avoidance. And so it's the same. We're always going to have, like for the jail, right? You're not going to shut down a wing of a jail and, let staff go. What's the actual cost of having someone in there? Part of that is staff time, but a lot of it is the other services that are provided. And so that comes into the policing and legal. So some of it is, if you look at just the like the calls that it takes to send a police officer to for a 911 call when they're dispatched. And so what we did is we looked at the fixed cost and tried to figure out what those variable costs were. And so there's a little bit of fixed cost in here, but it's mostly variable for each of the entities.
Michelle.
I had a response to that and then a question. My response is, one variable cost that we see related to this fixed cost is the number of visits for one charge. We find that, I'm sure this community and other communities that go before the courts sometimes take multiple hearings to get one piece of business done. And we've often talked about how do we get people to show up to their appearances, because it will not only save their future eventual charge total, but it will also save us money in the court system, because we won't be processing in court with those same people for the same charges over and over and over again, and then putting out warrants for them when they don't show up. My question was about the mental health crisis services and drug, alcohol treatment and medical detox. We know in our community that we have a vast bed shortage. And so what I wanted to know is, these are based on current beds, and don't you think they would change a lot if we had more beds?
Oh yeah, these are just very rough estimates, right? So Julie and I met in December, I think, right? And we started talking about it. And so the feasibility assessment I did for the city of Boise took a year to get the real numbers. And so these are just, they're very rough estimates. And so and I talk about this as we go further on, the importance of the data and really looking into like the resources your community has and the actual cost that your community has. So these are just based on the estimates of 25 people experiencing chronic homelessness, assuming they did have access to these things.
Julie?
And Vanessa and Aaron and I are meeting with the hospitals tomorrow to understand better that I think the 4 detox beds we have now, how it would change if we did preventative spending for detox, how those numbers would change and reallocate, whether or not we would see a beneficial increase in services and lower cost, or if it would be the opposite, if we'd be paying more for detox beds and not see a realized cost. But that's something we haven't even begun to tackle yet.
And maybe, so I've got a question in here too, if I can articulate it. So one issue with folks going through multiple rounds through criminal justice system or what have you is, I want to think of it as, I'm thinking of it as an opportunity cost, but that may not be an accurate way to look at it. There's a cost to the overall system where the system is overburdened with people. We're seeing this here every year. I've gone through budget cycle. There's been a talk about sort of the backlog how do you capture those do you try to capture those sorts of costs, or it would be difficult to assign values to them? I'm not sure how you would. Did the question make any sense?
Right, no, I think so. So I think it's and I'll get into this a little bit. All my numbers are based on true costs. We know it's more than this, okay. Right? Yeah. And so I'll get to that in a future slide.
Yep.
But I did want to just tag something that Councilmember Michelle said, and that is this idea of the criminal justice system. I don't know if you have problem-solving courts in Montana or in. Okay, so we should talk about that opportunity later. And so it's a way that Idaho, some communities, not all of the counties, have thought about taking targeted populations and really dealing with the issue at hand, which maybe isn't the criminal justice issue, it's the substance misuse issue, or that's a mental health issue. So, but it's a way to kind of reduce some of those issues that you were talking about.
Jesse.
Hey, just wanted to say I'm really enjoying this presentation so far, but I had a quick question that maybe you can help me with. I don't have a ton of knowledge around this area, but I know you're talking about some of the cost of the community with these medical bills, and wouldn't some of these folks qualify for federal programs such as Medicaid if they're at a low enough level? And also some of the folks with mental disabilities, couldn't they cover for Social Security disability, and then we can maybe get them with that money into a home where they're renting, and then ultimately maybe taking a little bit better care of themselves, and then paying having Medicaid cover a lot of their medical expenses? Is that something that some other communities have done, like Boise, or am I kind of off base with
No,
that?
Yeah, you're right on. That's a really, I think, important thing to consider. So different states, whether the states are Medicaid expansion states or not, have been able to access Medicaid dollars for the preventive services. So even if we're using the Medicaid dollars to pay for the emergency services, the idea is to not get to the point of needing the emergency services, right? And so this is the calculation of emergency related costs. And so that could be, Medicaid dollars that are going into it, or it could be, I don't know if you have indigent fund money that would go into it. So the idea, though, is to kind of reallocate the resources in a way. So, if someone can get, maybe they're not even on Medicaid yet. How do you get them engaged with Medicaid, get them into preventative care, and then help them from not going to the emergency room every time they have like an issue? Does that help answer your question?
Yeah, that's exactly what I was talking. Thank you so much.
Yeah.
Julie.
And Jesse, she's going there. She's going to get to the point where by getting somebody housed, all these costs go down, and then you're able to get them connected to services. She's getting there.
Yeah. Okay, I'm going to move on to the next one.
Yeah.
Okay, so like I was saying, I kind of put them in these buckets to help myself and then the communities wrap their heads around where the costs are. And I can say for certain in the city of Boise, when I did the same assessment, we were looking at, we have around 100 people experiencing chronic homelessness. And so the number was just over $5.3 million. And when I first presented my data, and all the data I had was given to me by the hospital systems and the criminal justice system, they were shocked, right? They were like, wait a minute, what? How much are we spending on this? It wasn't something that they were looking at. They weren't coding their clients or their patients in a way that would allow them to pull out this targeted population and see the number of frequent times they were seeing them. They knew they could give me a list of people and say these are our frequent flyers, but they didn't really connect those individuals with people that were experiencing homelessness. It wasn't the way our community was thinking about it. And from talking to people here in Missoula, it sounds like in some ways like there's Boise's maybe ahead on one thing and you're ahead on another thing, right? And so I think one of the reasons I wanted to come up here wasn't just to present what I've learned, but to learn from you, because I do think we have this opportunity as communities across the country to like really challenge the way we're thinking about things and help each other address these huge issues. And so this is the encampment that was in Boise that caused the mayor to declare a state of emergency. And what ended up happening and why he did was this particular encampment is along an alleyway that runs next to a homeless shelter and then right by the freeway, which is elevated. Although you can't see it in this, it's like further down, it's elevated. And this is November, and the highway crew saw the storms were coming in, and so Idaho Transportation Department called the city and said, well, you have to move these individuals, because if we plow, they're going to get crushed by the snow load. And the mayor was like, what? And they, it was this perfect storm of events that they'd been trying to figure out a way to encourage people to move in a way that would help them want to engage more in services. But it's weird in Idaho, the cities don't own their streets, and so this street is actually owned by the highway district, and so it wasn't within the jurisdiction of the city to actually make the people move. And so the mayor had to declare a state of emergency. So it's like, that's super reactive, right? That's not the way we should be dealing with these situations, but it's what ended up happening. It pushed the city to the edge and forced them to do something. And this is right when I was doing all my research. I was like, oh geez, is anyone going to want to share their data with me now? But what it ended up doing is it really got people's attention and made them realize, okay, we really do have a bigger issue here than we thought we had. And what it also made me realize is that there are quite a few businesses in this area, and when they cleared this area, they found I don't even remember how many hypodermic needles and excrement from humans and animals and diapers, and it was we're better than this, right? This is not how we should have anyone living in a country like ours, or really anywhere, but we have the ability to help address this. And so I realized, I was putting numbers to things, but there's some things that you cannot really put true numbers to. So this goes to the, how much is the real cost? What are these other costs that are hard to quantify? One of them is, so we have similar climates. So every year we have someone or multiple people that pass away because they freeze outside. What's the cost of that? Can you put a cost on someone's life? Certainly not. What is the cost to a nearby business that someone decides not to go to anymore because of the encampment or because of panhandling? So what are these economic consequences that we can quantify in some way through surveys and other mechanisms, but we don't really know the true cost. So like I was saying, homelessness is, it's not only inhumane, it is very expensive. And in Boise and in Missoula as well, so we know that the costs that I calculated are there's more cost than that, right? There's the economic impact and these social costs that are super challenging to quantify. And so again, we're looking at the individuals experiencing chronic homelessness. They're very high risk and they're high need. And if we look at what other levels of government or how do other levels of government facilitate us addressing these needs? Well, HUD, Housing and Urban Development at the federal level, has really come out and said, this is a group of people that we want you to target your resources to. So we're able to think about the way that we're using our funding. Again, not a lot of it, but the funding we have to target these high utilizers, the federal government's recognizing the need to encourage communities to do that. And then also thinking about so what do we do? What does preventative mean, right? What is the intervention that we should put in place? And there's a growing movement across the country to really use evidence-based decision-making when it comes to allocation of our scarce resources. And by evidence, there's a number of different ways we can think about it, but essentially what it is we need to find the most effective programs that we have in communities, and those are the ones we need to fund, right, in a preventative way. And if we can do that, we're going to see their success spread. We can scale them up if we think about allocating our resources in a more preventative fashion. And so what's the chosen intervention in many communities? The chosen intervention for this targeted population in Boise was a housing first approach to addressing chronic homelessness. And what Housing First does is it provides permanent supportive housing, but in a way that tries to reduce as many barriers to entering the program as possible. And so it's the treatment of, as usual, outside of Housing First is there's some qualifications that a client must meet in order to be put in a program. So some people probably have heard of like sober housing. Well, it's really hard to get into sober housing if you're an addict, right? Addiction is a disease. It needs to be addressed. But if we think of, again, if I had a blackboard up there, I asked, do you guys have a whiteboard in your council chambers? But if we think of Maslow's hierarchy, so of needs, right? So the triangle, the base level of needs for people, it's shelter and water and sense of community, right? Sense of belonging. Those are some of the base level needs that Maslow recognizes that in order for anyone to actually improve upon their life, address addiction, right? Think about gainful employment. these types of things, taking care of their kids, they need their base level needs met. And so that's what Housing First really tries to do. They say, you know what, we can't even expect you to think about any sort of employment or addressing your addiction without you having a shelter, right? So this is a philosophy. It's not everyone loves it, but this is what our community decided was going to be the best one. And this is the intervention that I chose to run the numbers on for Missoula. And so, what does Housing First do? So what does a proven intervention mean? And so it's proven in a way that there's been research that's been done across the country. So it could be an experimental design where there was, let's say, a population of 100 people that were experiencing chronic homelessness. 50 of them went into Housing First and 50 of them did not, right? So it's an actual experimental design where you have a control group that didn't receive the intervention. And there's a number of other types of evaluation that can be done, but this is the general knowledge that has come from those evaluations. And so when someone receives Housing First, on average, you'll see a 72% reduction in medical detox, so interactions with medical detox. The interaction with the criminal justice system is going to dip quite steeply. Same with interactions with any emergency departments. And then what we also see is with the Housing First approach, tenants end up remaining in housing a longer period of time than through other interventions.
Julie.
I just want to hammer one point home. $53,444 per person is what it's costing us for the intense, the frequent flyers, the highest utilizers, and I'm pretty sure we can meet their basic needs for less than that per year. So right now we're spending over $53,000 per chronically homeless person. And once they're housed, all these things tend to go down.
And I'm going to give some examples in the next little slide here that shows, so as I was doing this in Boise, so it's, the city was the one that was really looking at it first. The city said, and they were leading out, right? And I think Missoula does that too. You lead out. You say, we recognize this is a big issue. We're going to lead out and take a stance on this and say, how can we address this? And this is what Boise was doing. And then as I started digging into the numbers, I said to the city, oh gosh, you all aren't the ones that are actually, you're getting hit politically pretty hard, right? This is what was happening in Boise, the state of emergency. But I said, when it comes to the financial aspects of it, it's not the city that's actually having the highest costs. It was really the medical system and then the county, because the county is really the lead in the criminal justice system. And so the hospital systems said, okay, well, we get it. We get that this is your numbers here, but has it been successful in other places? We want to know what our peers have experienced. And so I said, okay, I can pull some data on that. What does it look like in other communities? And so I looked at, what I did is I tried to look at communities across the country that had done something like this. There's, I think with a lot of interventions like this, it's a newer approach, and what you see is larger cities kind of doing it first. And so I think that, cities like Boise and Missoula, if you head in this direction, we're going to start building the evidence base for smaller sets, but this is based on what some larger communities have experienced. And so in Denver, they had this collective called the Housing First Collaborative, and what they saw was they saw a 72% reduction in interactions with the emergency medical care, and so that they amounted to being a savings about $32,000 a year. In Massachusetts, kind of similar, so that 73% reduction, and then annual savings just shy of $30,000. And then in Seattle, they were doing a pilot program, and so they saw a 60% reduction, and then annual savings of almost $37,000. And so again, these are what other communities experience. We right now in Boise, and I'll get to that, we're trying to figure out what that would be exactly for us. It's you can make estimates, but you don't really know what it's going to be until you know the individuals that are going to be in the program, and then you can look at what their experiences have been in the past, and then kind of look and see when the intervention happens and what savings happens with them, like actual savings. And so another part of this kind of approach is so the house is one thing, but with permanent supportive housing, there's the supportive component that's really important. And those are the providers of the services, the wraparound services for the people that end up being housed in the facility. And so this is the rest of the former First Lady's quote. And the idea is we need to find not only effective interventions, but we need to find high impact nonprofits that can carry these out. We need service providers. We need boots on the ground that are going to put these interventions in place. And so again, we should support those boots on the ground that are doing well in our communities. And so there's organizations in all communities that do really good work. Maybe they haven't done that particular intervention yet, but then there's an opportunity for us to figure out a way to allow them, enable them to conduct that intervention in your community to see if it works. And so, and so that's, and it's a way of thinking of, again, allocating our resources in a way that it's going to be effective and it's going to be outcomes-based instead of outputs-based. And so this is kind of when I was doing this study in Boise is when it was really, okay, I know what the costs are, right? So, but what are the benefits, right? Is it going to cost the same amount of money for this proven intervention with these high quality service providers? Because that could be really expensive, right? We know how expensive it is for personnel, and that's what a lot of this is. There's the housing cost, but then there's also the cost of the boots on the ground that are going to be giving 24/7 support to the clients in this program. And so then I looked into the intervention costs, and again, I based this for 25 people. If like this was done in Missoula, I based it off of 25 people, but based it off of the intervention that we designed in Boise. And I can't say enough how important it is. This isn't fill out the blank for your community. Like, here's my intervention, just fill in your stuff. Like, it's your community has to be wrapped around putting this together. So it certainly wouldn't, we wouldn't have gotten to where we are in Boise without the community designing the program and choosing the intervention and selecting the service provider. So how we did that in our community is the mayor of Boise, in this state of emergency, and before that, he had to call that, started convening these housing and homelessness roundtable discussions. And so it was the county and the city and leaders from all sectors. So we had the private sector at the table, the nonprofit sector at the table, like I said, the county and the city, the sheriff, the jail, the police department. And so we were kind of all there talking through this together, and Housing First was the selected intervention. And then we said, well, what comes with that for our community, and what does the evidence say should come with a Housing First approach for permanent supportive housing? And so we're doing an assertive team approach. And so it's what happens is you've got a group of people, of providers that are like caseworkers that meet on a regular basis to address the needs of the clients that go into the program. Again, it's Housing First. So a client they get the option to go into the program or not. There's a few things they need to meet, but they're not forced to meet with their caseworker or forced to go into AA or any care. What the team does, this assertive team, is they're available to provide any services or help with any resources that the client may need. And what the experience across the country shows is once you give someone that shelter and you have people working with them to build trust, that little by little they start to matriculate into using services, right? So it's a voluntary approach, and they end up using them. And so that's what the case management team is. And then administration. So those are kind of two of the biggest costs. And then we've got the rental costs, which we build into it. This is assuming that this is assuming there would have to be actual cash on the table for rent, that there's no vouchers or anything. So that's the rental cost. This is also assuming that this is a 25 units in one place, so a single site approach. And so with a single site approach, there's usually some sort of security, and so it could be a 24-hour security person or cameras. There's a number of ways to do it. Providing people not only with the home, but again, the food. SNAP doesn't give enough money to actually feed a person for a month. And so we decided we needed to provide that extra funding because, again, base level services, base level needs of the pyramid. We also recognize that although we're going to try and locate the facility in a centralized location, there's still needs for transportation, right? If people get to the point that they're able to go out and get employment, it's important to provide some sort of transportation assistance. And then a damage fund in case something gets damaged, which always happens with people that were formerly experiencing homelessness or someone that's been housed their whole life, right? People punch walls sometimes. Dogs rip things up. So we needed to build that in. And so what does this look like here in Missoula if you're going to implement it? Big asterisk here. This does not include capital startup costs, or if you were going to do any like long-term evaluation, that is not included in here. This is just the cost for services, and I didn't include the one-time capital because it's gonna change really drastically based on whether or not you're retrofitting something or you're building new, and all those different variables that could go into it. And so this is what it fleshed out to be. So just a little over $400,000. And so it's not a simple math, right? We saw a couple slides back that we see reductions in interactions with each of those reactive services, but it's not, you don't see like, 100% of people are housed forever. That's not what happens. And so when we think about what are the savings or cost avoidance, it's not a simple subtraction. This is how much it used to cost, this is how much it's costing now, and this is the savings. And so this is an estimate based on kind of those averages. So, the criminal justice average was a reduction was like between 50 and 95%. So I picked middle ground on each of those and said, if we had that kind of reduction, what would the savings or cost avoidance be for the program here in Missoula? And so that's what this is reflecting. So, and so then, how do you do this? You still need capital, right? You still need to figure out how to actually make this happen. And so, this idea of investing in results, right? So we're spending a lot of money reactively. How do we get to this point so we can actually do this? Because it still costs money, right? So it's still, there we go. It still costs that, and that cost is going to need to be in place while we're still reacting, right? Because we need to, slow this down, but we need to pay this, and so there's multiple different ways for us to think about approaching this. I'm just going to talk about two here, but we could talk about an extensive list of different opportunities that communities have to access funding. One, I know that your community is accessing right now are low-income housing tax credits, and this is the idea for if you're looking at a new build project. And so this is what we did in Boise. So I did the feasibility assessment to look at addressing chronic homelessness for 100 individuals, and what we ended up seeing is that the savings for those 100 would be about savings and cost avoidance. It was about $2.7 million on an annual basis. And so, and we needed to figure out a way. We like you, we don't have any housing stock, right? So we knew we were going to have to do new build. And so we ended up scaling our program, and I'll show you the numbers. We ended up scaling the program down and then accessing low-income housing tax credits to do the new build. So that's an important component. It's not necessary, but this is a way to think about, especially if you're doing new build, which is something you'd probably do new build or retrofit here in the city of Missoula.
Hey, Vanessa, could I stop you? I should have stopped you before. Could you go back to the savings one? So do you see the same? Earlier in the slide when we were looking at the costs, medical associated ones were such a big portion of it. I mean, they really dwarfed the criminal justice engagement and the other. Do you see the same kind of breakdown in the savings? Could you break that down a bit in the apportionment?
Yeah, I've got a slide coming up here that doesn't, so we haven't implemented yet, so I don't,
okay.
But I have a slide from Santa Clara County that you'll see that you look at it, you're like, where are the medical costs now? The emergency medical costs, because that's what was severely reduced.
Okay.
Yeah.
We'll wait till that.
Yeah.
Julie.
So part of the reason why we invited all the folks that are in the audience here today and from such varied backgrounds is because the cost to each of the different departments in the city may not be that much. And maybe the cost or not the cost, maybe the loss that's being borne by different departments is heavier with the county, obviously, and heavier with the hospitals. Whether or not they choose to participate in a solution is wholly up to them. Whether or not this entire scenario works into Aaron's housing plan, I have no idea. But because this has worked in other places, it was worth explaining. Obviously, it looks like, when we're looking at these savings, you're talking about $53,000 versus $16,000. Once implemented, it does take staff, it does take supervision, but I'm hoping that the folks in the audience will see the value of tackling this, and that it's a cost savings to all of us, especially to the medical system and to the courts. I don't want people to walk out of here thinking the county is going to, or the city's going to fund this 100%, and then the savings are going to go to everybody else. It shouldn't work that way, but she's going to explain why everybody chipping in results in cost savings and benefits that increase over time. So.
Thanks.
So I mentioned this toward the beginning of our discussion, and the reason why I was first engaged to look into what was going on in Boise and ended up being I think my final assessment was called Ada County, because I realized, well, I can't just talk about Boise. I need to talk about our whole community, our whole continuum of care, was to look and see if we could use pay for success financing to address chronic homelessness. And so I just wanted to give you a look into what that is. So it's a relatively new financing mechanism that started in the UK in 2010. It was originally used to address recidivism rates in Peterborough. And so the idea was they saw these individuals that were being released from prison in the UK, and they kept on coming back in. And they're like, well, this is, what's going on? And they realized if they put some money towards some rehabilitation efforts while these people were incarcerated, that they would not recidivate at as high a level. And so they called that program in the UK, they called it a social impact bond. There was no actual bonding. And so when it came over here to the US in 2012, the New York City picked it up, and they ended up calling it a Pay for Success project. And they used the financing mechanism to try to address recidivism rates on Rikers Island with the juveniles that were out there. And it was pretty quickly after that those of us that are like super nerdy and into reallocating resources in an effective way started thinking about, well, what other things that can we apply this to in our system? How can we think about reallocating our resources? And so it's been used to address issues related to early childhood education. I think I mentioned asthma, issues related to foster care, homelessness, and just a number of them. And it keeps on growing. And so how it works, here's kind of a little model, is that a government identifies an issue. So in the city of Boise, the issue was homelessness, and particularly it was chronic homelessness. So we knew it was an issue. And there's a proven solution out there that we have a service provider that can implement. And so for us, it was Housing First, and our service provider is called Terry Riley Health Services. And so we didn't end up going to outside investors, but we could have. We could have said, we want to put this intervention in place at the cost of $1.6 million annually, but we need some upfront capital. And so we're actually going to look to the private sector. So this is how Pay for Success works. You look to the private and philanthropic sectors to provide upfront capital for the intervention. And so if you kind of think of it on a continuum, so you've got the people that are the target population, and then you have an intervention, but it's going to be a lot of upfront capital to provide that intervention. Because so in this case, it's in housing and early childhood education. It might be more classrooms and more teachers, and or in the recidivism, it's a program specific to helping people succeed when they go back into the community, and so there's then an intermediary that helps put the project together and the contract for all of this. Everything is implemented. So in our case, it'd be Housing First. We built the building and we get our clients in. And then an external evaluator measures the outcomes. And so In Boise's case, the outcomes that I have are pretty robust, and I've divided them up into the kind of categories we looked at, which is related to health and well-being, as perceived by the medical system, but also as perceived by the client. We think it's really important to be client-centric in this, and they need to judge their own success too. Interactions with the criminal justice system, interactions with the emergency shelter system, and so those are the kind of different mechanisms we have in place, and we're looking at reductions, specific reductions for all of those, and then an evaluator is going to evaluate whether or not that happens. And then in a pay-for-success model, if it's successful, that intervention, the savings that we looked at, that would be used to pay back the investor. And so not all at once, it's over a period of time based on the outcomes determined by that community. So it's a way to think about using capital in a different way than we're used to. And what we ended up doing in Boise was we started looking at, although we wanted to serve, we as a community wanted to serve all people experiencing chronic homelessness, we started to think about, well, what would happen if what are we really able to do today, right? What can we do today? And what if we broke it down into these different categories? And so we looked at, what if we did 15 units that were current units available and they were scattered about the community, and then added another 35 units in a new build. And so we kind of looked at what the costs were for that. And we were having these housing and homelessness round tables, and I'm still going around the community refining my numbers. And then different parts of the community started asking, well, can't we just do this ourselves? What if we put in some money, we the county? What if we, St. Luke's, which is one of our hospital providers, and St. Alphonsus is the other one. They said, well, what if we put in money? How much would we need to put in? And so what we ended up doing is we ended up looking at doing a single site new build to serve 40 people that once they moved in would have been formerly chronically homeless, and then using an existing service provider in the community, Terry O'Reilly, to supply the services. And so that was kind of what we went with. And the county, who had never they'd never really let out on any of this, they said, we want to be the one that holds all the money, and we want to be the one that has the contract with the service provider. And then I helped them write the language in the contract to make sure there was robust evaluation. And so what they ended up doing was a pay-for-performance contract with the service provider, which they'd never done before. And we're not actually sure if any other entity in the state of Idaho had done it before. And so the contract is lined out very similar to like a pay-for-success project. We just don't have the external money coming in. So the community was able to raise all the money in-house to put this project forward. And so there I am. Woohoo! That's a rendering of the building. This was this fall, and this is at the groundbreaking. And so this is them breaking the ground, I guess, is technically what's going on there. And in that picture, we have the CEOs of both hospital systems, the mayor, a county commissioner, the person from our local housing authority. There's some other stakeholders in there, but literally the people with skin in the game, right? And another reason, when I was working with my colleagues across the country and we were looking at this to do a pay-for-success model, there hasn't been a multi-payer program put in place. Although in many of these social interventions, a lot of different entities in the community are going to reap benefits, there has not been a contract with pay-for-success where there's been more than one payer. It's usually been the government that pays. And so we're saying, well, can't we just do it this way? Can't we all put our money in? And all of the entities in the picture are also providing data for the evaluation. And it was data that they wanted, right? They want to know what their return on their investment is. Just like a regular investor, they just happen to be, in either the nonprofit or public sector, or in their hospitals are both nonprofit hospitals. And then that's the mayor. He's like really excited about it. So I work at Boise State University, and originally I applied for a job to do this at the city because I was like, this is so cool. I'm going to leave my job at the university and I'm going to go do this. And then I told my boss I was like going to leave. He said, well, no, can't we do this here? I mean, we're a university, we do research. And so I went back to the mayor and I said, you know, and I thought about it. I thought, this really is better. If we can be an objective third party that doesn't have skin in the game, it'd be better for someone outside the mayor's office to do this feasibility assessment. And then I had the whole university behind me too. It's not just myself, it's the whole university that can put their weight leaning into the project to do the feasibility assessment. And then we're going to do the long-term evaluation too. And so when I first pitched that to him, he said, I really don't like working with academics. It's awful. They come in and they look at us and they tell us everything we do wrong. They tell us how they're so smart and how we should change things, and they leave. And they don't actually help us do anything. And I said, we're there with you. We're going to see this through. So I was like, we saw it through. It was super exciting. So was Julie going to ask? Were you going to ask a question? Yeah.
Go ahead.
Are you going to get to the point where you talk about 2.6 million versus 740,000, and that had it been a traditional pay for success model, you would have been able to have that return on investment?
Yeah. And so if we would have done, so the idea is, not all communities have that capital available. Not every hospital system is going to be able to put that money forward, nor is the government. And so what we probably will do, what we might do is we might have this be a proof of concept and then use outside financing to scale it up and then help us kind of redistribute our resources. So the plan is right now, if the building is being built right now, but if it all goes forward smoothly, it's a September move-in date for these clients. And so we're in the process of setting up a prioritization process to make sure that those that are selected into the program are the highest utilizers of our services and also are experiencing chronic homelessness, and that we can get enough data on them to know what they have been experiencing and then look and see how the intervention changes in the future. And this is what this next slide is. This is from Santa Clara County, and so months since housing is on the bottom, and then number of utilizations is going up. And so you can see, like, at 0 is point of intervention, and then going back would be 30 months back. And so so I was saying I'm putting this evaluation in place, and I was explaining to one of my students, I teach in California, and one of my students there, I was saying, I'm trying to come up with this evaluation. I want to show this, I want to be able to show this visualization of savings if it happens or if not. And I was explaining this to him. He held up his phone. He said, "You mean like this?" And this was the graphic. And I was like, yes. How did you do that? And he did a report on Santa Clara County, taking the evidence from their Housing First program to see how the changes had happened. And so you can see he sent me a screenshot, so I don't have the whole everything to the right, but it's all the kind of reactive services that have been in place. And so so it was pretty stark for me. I was like, oh, that's exactly what I want to be able to show in a dashboard way, because I think also something that I found in communities is that not all the stakeholders in Boise readily opened up their data when I first started speaking with them, because people are afraid to dig into their data. What's it going to say? Maybe we aren't doing as well as we thought we're doing. But what everyone decided was, well, unless we know what's going on, we won't know how to improve. And so there's this kind of agreement that we're going to open our books to data so we can make sure we know what's actually going on in our community. And then again, we'll know how to target the services to meet the needs that are that these clients have, or these potential clients have. And so I think that the idea of open data and figuring out a way to share data that still protects the client, right? So we're not putting the information on individuals out there in the paper, but in a way that we can help serve them better, is really an important discussion to have in communities.
Do we know what the green big band is? I appreciate it's a screenshot.
I know, right? I know.
It's got to be a medical.
I think that's the emergency. Yeah, that's the medical emergency one, I think.
That's what I figured it had to be.
So, and then that's my last kind of data slide. And then I just, any questions or anything else we want to discuss?
Julie. Stacy, I did it before earlier today. You're Julie in my mind today.
The blondes in Ward 5 are throwing everything off. Thanks so much. This has been great. One of the questions I have is, Boise obviously sounded like it was in a unique situation because you had people who had capital to put into it. In other communities where that's not the case, what is the enticement for the investors? Because per the slide you showed that kind of walked through the various steps, the investors got paid back based on the savings. Well, that's great in the model, but when you go to the investor and ask for that upfront capital, what do you, enticements, promises, or various things to get, in case it isn't successful or isn't as successful as you're projecting?
Yeah, that's a really good question. So I should have said they get paid back their principal and interest. That's a negotiated rate that the interest. So if it's successful, it's not just their principal gets paid back; it's principal and interest. And there's a number of different ways communities have approached it with the investors. So some. And these are big investors. This is like Goldman Sachs, J.B. Pritzker. So it's like names we've heard of that have put their money into these programs. One of the reasons why they've done it is because they really believe in helping society. Most of their money isn't being poured towards things like this, and so they're willing to take a little bit of risk to do it. But also what has happened is they're not the first loss. So they tranche it, right? So there's going to be a first loss. And in the example on Rikers Island, the first loss was Bloomberg Philanthropies, which was really easy for the mayor Bloomberg to commit to at the time. That's not all mayors have this amazing philanthropy, but that's what we see happening is you see philanthropic capital come in a way that they're willing to take a loss because they're already kind of investing in the system. That they're going to give that money to the preventative or maybe even reactive services, but to address homelessness or education, and so communities have negotiated with them to say, well, what are the terms of the agreement where we can take some risk off of the investor? And so it's just like any other investment where you sometimes have someone come in to say, well, we're gonna take some of the risk for you. So, yeah.
So the facility that's being built, 50 bed? Is that
40?
40. Mm-hmm. And the chronic homeless population level in Boise, I remember 100 something?
Last year's, when I did the research, I based it on the prior year's count. I think right now it's at 130.
Okay.
Yeah.
So I was just wondering, was there any, why the build at that level, given the 130 number? I mean, obviously you wouldn't want to build at that level, but was that more of just a conservative, I don't know. What was the thinking behind that number? It
was the money that was able to be raised. This is what the entities were. They said, we want to kind of test this out. That was basically what they said. They want to know that if they're going to, if the hospital systems are going to put in each right now, I think they're committed to $250,000 a year. If they're going to do that, they want to know that it's, there's actually going to be a reduction. And this is, I should say, the success is based on, or the performance for this performance-based contract is based on those individuals' clients. So the changes that occur in those clients' lives, not the overall hospital system, because we can't control for people moving into the area or for something else happening. It's really just with those individual clients.
Got it. I want to invite members of the public to come up. It doesn't have to be a question. I'd like this to be broader, more discussion-based. And I was going to specifically invite Erin up to ask her, put you on the spot of what, the timing is fortuitous. We've had really good updates about the coordinated entry system and various other aspects of what we're doing here. And I'm just curious about your observations on any aspect of this, what you may have learned or thoughts.
Yes, absolutely. So we did talk briefly today about our grant with the Corporation for Supportive Housing and Montana Healthcare Foundation and the Fuse model, which really, Vanessa and I spoke about it earlier today, really dovetails well with a project like this. So as Vanessa mentioned, Boise's likely about 2 years ahead of us. And so they engaged in this feasibility study and collection of data and really looking at what would work for their community, which is the process that we're just starting through the Fuse grant. And so we do know, though, that we have a core group of chronically homeless individuals in Missoula. It was 42 at the last count, who are high utilizers of our system, frequent utilizers of our hospital criminal justice, behavioral health systems that we are not effectively serving now. So again, it's that double win of cost savings to the community and better outcomes for people who have been experiencing homelessness for decades. So this dovetails really well with both our division's current efforts, but also the stage that we're at within the 10-year plan to end homelessness, focusing on permanent supportive housing for our most chronically homeless individuals, especially even targeting further those struggling significantly with substance abuse and substance misuse issues, is a key initiative in the plan, and one that we had hoped we would be further along with at this point in time. And so I think that we're in a really good position to move ahead with that through the FUSE process with solid data that we can collect and work with the county and our hospital systems and the criminal justice system, and work in alignment with other plans like the jail diversion master plan to really make some headway on these.
Nice. Gwen.
I wanted to follow up on something that you said, because as I was sitting here, I'm thinking we talk a lot about wet housing for the master jail diversion plan, which I assume, well, for example, hypothetically speaking, if something like this was built where there was housing first, and to what degree would that usurp our wet housing proposals that we talk about? Or are there still some people targeted by wet housing who are not necessarily homeless? How does that work?
Yeah, well, we really talk about permanent supportive housing, which is kind of the global term that captures people who require affordable housing, typically with an ongoing subsidy, but as Vanessa pointed out, provides that comprehensive array of services to support people and keep them housed. Those are typically people with significant addiction issues and chronic homelessness. I'm not a huge proponent of the term wet housing. We don't use that often, but that is so permanent supportive housing is targeting the most difficult to serve individuals who have typically been on the street for a very long time. And so that is kind of that core population of folks that are being unserved now. And so this would fill that need.
Stacey.
Go ahead.
I
was just going to say, I'll offer up an alternative term. We have what's called the Serial Inebriate Program, which is also SIP, which is weird, but still, it's a mouthful. Yeah. But to in a way to think about it other than wet housing.
Yeah.
Stacey.
So earlier in the presentation, you talked about how with this housing first model, you weren't making people, have jobs, have a lot of, because they just weren't in the capacity to be able to deal with those issues when they're trying to just figure out where they're sleeping that night. What requirements of the participants who are participating in this program do you have?
Yeah, that's a good question. So the developer of the property, so they're the ones that access the LIHTC credits and to build the property, the company has specific limitations on who they can put in the housing just based on the way the company's built. So they can't, sex offenders can't go into the housing because they see it as high risk, that's a part of the population that is very difficult to house, right? So there's some limitations. I think violent felons with a felony within a certain period of time aren't allowed to be in the units. Beyond that, there's once you move in, if certain things happen, you can be kicked out, but it's pretty low barrier to entry to get in and to stay in. So someone foreseeably could move in, not break any rules, and be there and not access services. It's really highly unlikely from what we've seen across the country. People usually end up accessing services.
Follow up?
Yeah.
So the other question I have is, you didn't really talk about this in your breakdown of costs, but someone who's going to jail quite frequently, utilizing the criminal justice system is cracking quite a bit of fines. And is there are you working with municipal courts or whatever court system to, if someone's in the program, to alleviate some of those fines so they don't continue to have that that cloud of fines to hanging over their heads?
Yeah, that's a really good question. And so what we're trying to do is there are certain ordinances in place in the county and the city that we're looking at to say, can the county or the city waive those because of, especially the ones where someone got a misdemeanor and they then got a fine because they didn't show up to court, and then they got a fine because they didn't just show up to court or pay their, it's cyclical and horrible. And so the system's trying to figure out a way to forgive those? So that's a good question.
So there was a flurry of hands. I'm just going to start here. I saw Heidi's.
So I realize you're probably not this far along in Boise yet, but I find it's often really hard to transition from like one tier to the next. So say going from being a renter to a homeowner, or maybe being in supportive housing to being a independent renter. So I was wondering if there's any communities you can look to see what the long-term effects and maybe the numbers are on folks that successfully graduate, that's probably a bad word, but out of supportive housing and into like the regular market.
Yeah, I don't have those numbers on me, but I definitely have them because I looked at, when I ran my big model for Pay for Success, I looked at both negative attrition and positive attrition, right? So we didn't want to penalize. So one of the metrics for the Pay for Success program that I was originally assessing was time in housing. Actually in the as a client in the program, and we wanted to make sure that someone that kind of graduated out, whether the family accepted them back in or they were able to move in their own unit, they weren't penalized. So I definitely have information on that. It wasn't a crazy high percentage, but it exists. I feel like it was in the high single digits, but I can look for you, and I will write that down or else I'll forget.
Gwen, Heather, no. I'm phantom hands. Michelle.
I just really want to hear from the people in the audience before they leave. And so I'm going back to your earlier invitation to invite them up.
So you're saying we should adjourn right now? No. Please, additional folks that want to come up. Questions, comments, observations. Queue up. Don't all storm the table. Come on up.
Hello. Do you want me to introduce myself?
Yes, please.
I'm Bree Lopech. I'm the program administrator at Winds of Change Mental Health Center. So we have case managers, and I have an understanding of what it takes to employ them and support them. As far as your case management numbers for supporting the people in these housing first models, what exactly does that entail? Does that entail their salaries, their benefits, their admin costs? Is that the whole deal, or how is that broken down?
Yeah, in the slide I had up there, I had admin separate from direct care, but I'd be more than happy. I could give it to Erin and she can make it public. I have a spreadsheet with a breakdown of, I think it's for like 15 units, 35, 50, and 100, and how at least so Terry Riley Health Services would maybe be your sister organization. We took their numbers, and then an organization called Catch, which is Charitable Assistance. What is it? Anyways, it's Catch, and they help families, and they do transitional housing, but they know about working with people to like move into a home that haven't been in a home, so they provide that level of service. And so I can give you the breakdown of all of the costs and the administrative costs, and like we built in transportation for the employees so they could drive back and forth. I'd be more than happy to share that if that would be helpful. Yeah, okay. I'll write that down. Share with everyone.
Thanks.
Yeah.
I think I have another question. So, with your kind of pilot program, how easy is it to fail out of for the participants? Do they get a few chances? Is it pretty immediate?
That's a good question, and that's the way that the contract. So it's this pay for performance contract that the city has with the Terry Riley Health Services, and then it doesn't dictate in the contract how Terry Riley meets the performance measures. So Terry Riley needs to determine. They're in the process of determining those kind of like. I think it has to do with like aggressive behavior, and there's these different things they're trying to put in place, right. But they're also trying to set people up so they don't get to that point of failing out. But we don't have it completely in place yet, which freaks me out because it's like launching in September. I'm like, we got to get this, but but it's these things to consider. It's like even when building the stairwells, like they have to be a certain way to deter particular activity. And like, good thing there's housing developers out there that think of those things, or the way that our camp, we ended up not doing security 24/7. There's someone on site 24/7, but we ended up doing a camera system and then like key card entry, and I think there's like keypads, and so there's all these different ways that are a little bit less expensive but provide the same level of service. And so because it wasn't dictated how Terry Riley did it, they were able to kind of work within their budget to address some of those issues.
Okay. Well, thank you very much for your presentation. Thank you for having this happen.
Thanks for coming up. Other folks? Yeah.
Hi. I'm Jenny Graff. I'm the Economic Development Director for Missoula Economic Partnership, so I appreciate that it is hard to quantify economic impact. So I was curious, I was researching this a little bit just to kind of investigate how other communities might be leveraging some of the financial stacks like New Markets tax credits or other programs, and a lot of them had, kind of back to work initiatives like a commercial kitchen or something like that. Did Boise look into those options, or am I kind of trying to add too many factors to this?
No, I think it depends on the outcomes that like your community would want. And so if workforce is a really important component, like so if Boise said, you know what, it's really important to us that people that get in here have like some sort of on-site workforce training for this whole industry or something like that, they could have done that. It wasn't something they chose. They will be providing, I think Department of Labor is kind of helping out a little bit. They're going to provide support, but there's not like direct intervention along those lines. And so we didn't look at accessing any of those funds for that.
Okay.
But it's a good idea.
Okay.
Yeah.
Julie Armstrong.
So I do want to put some people on the spot. So I know we have a lot of partner agencies here. If you have a business or if you're representing a business contingency, I'd love for you to come up and explain how you think homelessness is affecting revenue here in the city. If you have any stories about it, if you think we're ready to do something, if you think as a partner agency or as an investor this is something that we should tackle and that you're ready to do that, I'd like to hear that too, because we need to hear as council whether or not this is something that the community wants to move forward with.
As you queue up, I'll go to other council members who raised their hand. Julie Barrett.
Could you go back to the slide where you came up with that $409,000 figure, if I'm remembering it correctly?
It's a big slide deck. Let's see. Okay. Wait a minute. Nope. Oh, wait. No, the cost. Sorry, the delivery.
There we go.
I could be right here.
That one. That's one. Actually, and if you'll go back to the pie chart, then.
Wait.
Right there.
Okay, sorry. Jeez.
So I guess what I was thinking about was that, like, maybe this is a snapshot of what it costs the first year or the first 5 years that someone's there, but that perhaps some of these costs go down over time as the people get more established and maybe need a lower level of support. Is that worth factoring in?
Yeah, that was something that our community talked about, and it's one of the things that's really hard to tell. Even so, Terry Riley, who's going to be putting this team in place, so she needs to do it before we have the clients, but part of the team is like the qualities of the team and the skill sets is going to be based on the needs of the client. So there are these all, like one of the things we think is actually going to happen is there's going to be maybe a spike in some of the costs before we see it go down, because if you're offering up services and people know how to access it more, maybe they initially like go to the emergency department more because they're still not quite to the point of like having the preventative care. And then we did talk about kind of this positive attrition, or as people get more successful, it's a possibility, but it's I didn't see any other place quantify it in that way, certainly not in a pay for success project. And I didn't really see any evidence behind it to show. I think our thinking behind it was that there might be some positive attrition, but then someone else would come in that would have a higher level of need and balance it out. And again, we won't really know until we see it, but that was kind of our thinking behind keeping it the same. So when I did this, like my big financial model spreadsheet has this. When I did it for Boise, I think it was out over 10 years or something, and so we can like build in inflation and all these different things to see how things could change.
Stacy.
So I know that you guys you broke ground, hoping to have people moved in September. Who is really kind of farther down the track in terms of other municipalities or cities that you look to kind of model after? And then I heard you right, you saying that there's only the positive attrition rate is in the high single digits, is what you are projecting. Did I hear that correctly?
Yeah, I'll answer the second question first. And so that's, I need to look back, but the evidence that's out there, so this hasn't been going on for like a terribly long period of time, this type of intervention. And so the amount of actual evaluations that are in place that are robust, it's pretty low. It could be based on that. There could be a lot of reasons. But the idea behind permanent supportive housing is just that it's permanent. That's like forever. So you know what I mean? So that we wouldn't expect, because these people that are going into it are at such a high level of need, what we're probably seeing that, so before we institutionalized mental health in the early 80s, some of the people that would be coming into this would probably have likely been institutionalized, right? Unable to live on their own. So need of constant support and access to services. Not all of them, certainly, but some of them will need support their whole life. And then, okay, do you want me to answer location one?
Yeah.
Okay. No, it's okay. So some of the communities I was looking to that were kind of in tandem exploring this with me, Denver, was one of them, Santa Clara County. And again, these are like bigger places. Salt Lake County in Utah. They all, and these are all pay for success based projects that I was working with. Mm-hmm. We're starting to see more of a move towards this idea of pay per performance. And I think that we might start seeing that in smaller communities. Another thing with investor dollars is, Goldman Sachs isn't throwing $100,000 into projects, right? They were looking for big in, big out. And so I think some of the other communities, what we're going to see is them doing more of the pay for performance style, as long as they can get that capital locally, probably through philanthropy to do it. But like each of the communities have done it so far, have done it in a different way. So kind of like I was saying before, it's not, I could give you our contract that we have between the county and our service provider. You'll end up rewriting it for yourself, mm-hmm. because it's going to be really that it needs to be place-based and community-based. And so the city of Denver originally, their program is for 250 people. That's a lot of people, right? And they were going to use chronic homelessness as the first kind of cut to get people in, but then they realized it was really people in the criminal justice system, the frequent flyers. And so they're working with the criminal justice system first, and then kind of checking and seeing if people have experienced homelessness or are chronically homeless. Most of them are. Their population is so much bigger, so they're kind of able to pull that. But it's a little different. Santa Clara County isn't basing this is pay for success. They're not basing the payments based on reductions in any cost. It's more the increase in quality of life and care for the individuals. So it's more of a it's not a quantitative thing as much as it is a qualitative thing. Mm-hmm. And so people across the country have done it differently, which is fascinating. But then we can't look at something and say, oh, this is the way you write a contract, because it's different. So And you had another
follow-up?
Yeah. So Terry Riley is the contract or people who are going to be providing the services to the participants. And you mentioned that there isn't a focus on workforce development training or anything like that. But is there a social work component to kind of dovetail off what Council Member Ramos said in terms of getting them signed up for Medicaid, if they're veterans, getting them, the services that, they may not had know how to access that would be available to them.
Yeah, one of the metrics for success or for performance is access to mainstream services. And so, and that all the other performance metrics are over 6 months, and then the first performance point for access to mainstream services is at 6 months, because sometimes it takes a long time to enroll in these things. But and then there's a number of mainstream services, so SNAP and Medicaid, if possible, VA, so all those different access points, and then if appropriate, job training.
Yeah, thank you.
Yeah.
Heidi, and then Chris.
So I have a question about how you guys decided where to site your building. And I know that we've had, I know when the POV relocated, it was a difficult process, maybe on our neighborhood level. But yeah, like, is it based on like geographic services or where people protest less? Just if you could speak to that.
That's a really good question. I was in Salt Lake last week, and there were people across the country that came in from all sectors to kind of talk about how to do this. And there was someone I was talking with, and I can't remember who she might have been with. I don't remember. It was a national entity, and she was saying she goes to communities and helps do siting, and how they'll drive around. It'll be like an industrial park, like 5 miles out of town, and she's like, no, you know, it's like access to services. And so there's this, you know, there's this balance between being appropriate for the community. You wouldn't necessarily put a 40-unit building in a neighborhood with all single-family homes. And so it's this idea of just like planning and zoning for the rest of the community, right? So where are you placing multi-unit residences? And then also making sure that we don't ghettoize homelessness, right? Like, the projects are called the projects for a reason, and no one wants to live there for a reason. That we've known for a long time that success and integration and multiple types of people and multiple housing choices in one area are end up being better for the community as a whole. So I think it's really important to do that. So with this project, when it came to siting, so there was an RFP that went out to to developers, and with it was the tax credit kind of like carrot, like, hey, you can do this. And so but we had certain qualifications, and so near transit, near services, I can't remember what they all were. And so this is actually, this building is really close to downtown. It's right behind it is a neighborhood, actually. What used to be here, so this red building in the background of the people that are breaking ground, it was called it was a Chinese restaurant, and the word dragon was in the name. I can't think of what it was called, but it was kind of like everyone knew it, like, and it's been an eyesore. So this is kind of like a brownfield. So people were, they saw the rendering for this building and they thought, oh, thank goodness. And so shockingly, this had to go through planning and zoning just like anything else. Shockingly, no one came and protested it. I mean, I don't know if it's just because we'd been working on it for so long or what, but every day, the time people were like, okay, when is it going to happen? When's it going to happen? But I think it's just the way the building was designed, the way it's set up, the face of the building's on like a fairly busy street, but transit's on it. And so you wouldn't necessarily build a single family home there. So it'd be a perfect place for like a mixed use building, but it just happens to be residential. So, yeah.
Chris
Boza, City Forester. Could you go back to your slides where you're talking about your costs, and that'll be kind of a starting point for some of
for homelessness or intervention.
Yes, right. Well, no, all the way back further.
I know, right?
There you go. One of the things I was looking at that, and I am with the Parks and Recreation Department, and I have one division of three in the Park Operations Division. And one of the things I didn't see on here, which was very interesting, is that many homeless folks utilize parks as their day shelters. They also use those as their sleeping facilities. And I have one section, greenways and horticulture, and I did some quick calculations. We spend about $20,600 a year, which equates to about 5 hours per week from shoulder season to shoulder season, addressing cleanups of various encampments along our park. Or along our greenways. So and that's just one of three divisions. There are two which are more highly impacted. So I look at your community costs; those aren't incorporated into there. Yeah. And so that follows up on two questions, or actually three. First off, how did the Park Department in Boise interact with you on that? What was their input in it? In the probably the bigger question, you talk about taking those avoidance costs and giving those to the investors on these types of programs. How successful have you been with cash-strapped departments who are bare bones to begin with?
Yeah, those are good questions. So I'm trying to think of where Parks fits in Boise, but they were definitely at the table. And when we were doing the cost analysis, nothing ever came up for the need to integrate their costs. So I don't know why that's the case. We do have a pretty robust day shelter system, and so I don't know if that alleviates it. We also have the police department has community policing, and so they're pretty frequently moving people out of areas. So I think definitely, I mean, like I was saying before, it's so place-based, and so it's so important that if this goes forward in your community to think like, wow, that could be a significant, over the course of a couple of years, that's a lot of money. In 1 year, it's a lot of money, especially for a cash-strapped department. And so that'd definitely be something to work into as a cost.
And the final question is, when homeless people gather in our parks in various areas along our greenways, other citizens avoid those areas for that very reasonable reason. They consider that an undesirable element. Have you quantified the costs to the citizenry for folks who are avoiding those parks and areas because there are homeless there?
Yeah, no, we haven't. And that's just like we didn't quantify it also for the businesses that were not being frequented as much. And so I think, there's easy ways you could do that, definitely. And I think it's really important to think about, those intangible costs that are really hard to think. But think like, you're a taxpayer, that's your park, you want to be there, that's where your kids like to ride their bikes, but now you're like, what do we do? In Boise, there was the way that, so that homelessness encampment, I was saying it was near a shelter, which is also near a day shelter, which was under the overpass from the highway. So I was saying the highway came in. Well, under the overpass, that's where a lot of people would congregate. And what ended up happening was a foundation put in flush toilets and a skate park to allow congregation to happen, but in a more like in a fashion that was kind of more welcoming. And so you actually still see people that are there that are likely homeless, but then you also see other people going there. And there's community policing there all the time, and there's families that are there and kids that are there. So it's pretty interesting because you see populations interacting that might not normally interact. And so there was kind of a philanthropic investment that went in there to help it, created a park in a place where people were, and said, well, we think we can actually work with this. People don't sleep there anymore because it's a skate park and it's like lit all the time. But yeah, there's certainly costs that would be associated with that. We have the Boise foothills that the city owns part of the property in. And so they, I know, deal with illegal camping out there a lot. And so to think like, what are the costs associated with that? And so again, it's like community policing that usually go in and clear it out. So, yeah.
Thanks. Jesse.
Thank you.
Hey, thank you for the presentation. I really enjoyed it, and I think it sounds great theoretically, but I just had a couple of quick questions about this. So in your presentation, it seems to assume a stagnant homeless population. Again, I'm not trying to sound insensitive, but just looking at it from a fiscal point of view, it assumes a stagnant population of homeless. So let's just assume there's 325 homeless folks in Missoula, and then let's assume that you do the program for 25 of them. That's going to cost $409,000. So that's going to drop down the homeless population to 300 folks. But let's just assume over that first year, that another 25 homeless folks move here. Don't we still have the same exact fiscal problems with the 325 plus an additional $409,000 that we're contributing? Isn't that kind of like a compounded infinite cost? That's kind of, I just wanted to know how you would address that question. So
yeah, that's a really good question. I wish Bill Bones, he's our chief of police, he always loves answering that question. And he's much more articulate at it than I am. But so, we have the fortune or misfortune of being in like urbanized areas and very rural environments, right? So when we do see people coming to, whether it's Missoula or Boise or Bozeman, people tend to go where services are. So, our homeless population that we have they weren't all born and raised in Boise, and I doubt yours was born and raised in Missoula. And so what we end up seeing is that people definitely, or in Boise, there's other communities that have purchased bus tickets for people to come to Boise. It's a lot cheaper for us to export you than to deal with you. And so as a state, we're kind of thinking about that. Part of how we deal with it is through how we prioritize people to get into the system. And so it's based on, the way we're trying to do it is based on the cost that the people there have on the system. So to receive services, if you're going to be prioritized, it's based on kind of length of time homeless, as well as interactions with the criminal justice system and emergency medical system locally, right? And so you don't move in and become first on the list, but I think it is, again, about how we as a whole are thinking about spending our resources. So if we can look to other communities, and like right now I'm working with a community in eastern Idaho who came to the institute where I work and said, we really want to bond for a new jail, we need it. And I was like, well, tell me about your jail population. What's going on there? And what it came down to is they've got crazy high recidivism rates, right? So thinking about how to be more preventative to make sure that people don't get to the point of being homeless in the first place, not just in our communities, but the communities that we're associated with. So in Montana, you've got a continuum of care that's statewide. So you're really acting as a state to address this issue. And so how can you take the concepts here and the preventative measures here and try to encourage your peer communities across the state to address it? I think we'll always see fluctuation. The country's becoming more urbanized. Right? Look at the census. We're becoming a very urbanized population, and so people are moving to city centers. And so I think we're going to continue to see an influx of more people needing services. But I think it's how we're addressing those services. I don't think it'll be, and I don't think that these don't assume a stagnant level. It's just we're just looking at 25 people, right? So it could be that we have a fluctuation on our homelessness population that over the course of a year or a couple of years, this is just looking at specific people and addressing their needs. Then we have to think about how we address the needs of those outside this targeted population. But I think there is a misconception that people if you provide something, they will come. And so the evidence base isn't out there that they're gonna come and fill in the blanks that those 25 people were in before, if that makes sense. But we will see people coming to urbanized areas. That's just going to happen, right? Especially Boise and Missoula, where we're less expensive than other urbanized areas, right? And so we're going to see people, migrating across the country as they need places to live that are less expensive than, the coastal communities in other big cities.
Thanks. I think the last part of what you answered too about there isn't the evidence out there that supports the notion that it's just we fill in those blanks.
If you build it, they will come.
And I think you made a distinction at the beginning too about talking about chronically homeless people versus that broader population of people as well, right?
Yeah.
Quick queue of people, Michelle.
I had a follow-up to this conversation and then a question. Just like Brian was saying, we heard earlier that chronically homeless are 12% of the population, but 50% of the cost. And so if we think about backfilling or additional folks coming, it would stand to reason that not all new folks would be chronically homeless, and in fact, probably very few. So the costs would not be equal to the costs that we used to incur when these folks weren't housed. My question is, earlier I had said that we don't have problem-solving courts because I sort of misunderstood what you were saying, but I looked it up and we do. We've got drug court and a veterans court, and what I was wondering is what type of problem-solving court were you talking about when you were referencing addressing this issue of people who can't get to their court dates?
Yeah, so I just did this comprehensive study of the public defense system in the state of Idaho. So I have studied the court system a lot, lucky me. And so they call all of untraditional courts problem-solving courts. And so it could be focused on, they're focused on different target populations. So juveniles or addicts or mental health. And so it just depends. They're doing a trial one, and we'll see how this goes. It just was one of the nonprofit service providers, Interfaith Sanctuary, they have an emergency shelter. they are going to try and do some sort of intervention that's like a homelessness court, but they're not a court, so I don't know how they're going to do it. I think it's a good idea, but I don't know if it's the concept they're going to try and push to the court system, but they want to do that. So the people that are addressing the fines and that's at the city level. It started in the police department, and thinking about where are these low level offenses that really actually are kind of a result of them being homeless and not crazy malfeasance. And then same thing with the county level. Does that help?
Sure. This is just a comment. We've just had an article earlier this month about how the Veterans Court is having trouble funding itself. And so when we think about problem-solving courts, it's like, well, we could build it, but then could we fund it? And making the case for your entire presentation would be essential in terms of the long-term sustainability of that project. Thanks.
Heidi.
I was just going to follow up on what you said, Michelle said, about that total large number of homeless in Missoula being a bunch of different sorts of homeless situations, and that there are distinctions between different populations and different services for those populations, and this pertains to the chronically homeless. That's all. So,
Stacy. Gwen.
I had a couple of thoughts. I thought it was an interesting question that Mr. Ramos raised, and first of all, and I'm sure people will correct me if I'm wrong, but one component of Missoula's homeless population, my understanding is it really started or gained more traction. There were more people who were homeless in Missoula during the Depression because people would ride the rails, and when they'd get to Missoula, if it was winter, they couldn't go over the pass because they'd freeze in the boxcars. So they'd winter in Missoula, and then they'd continue on, and that happened during the Depression, and that created our history of this was a giving community, and we would take care of those that were here. And then combined with it being a university town, Missoula, out of all of Montana, has historically provided more services and taken a little bit of a different tack on this. So I think it's important to look at the history, but then also I've had the pleasure of hearing Teresa Williams, I hope I got your name right, twice in the last couple of weeks, which for the new city council people, it is great to make use of these opportunities. She was at City Club speaking, and then she also had a presentation here in council chambers one evening on our homeless plan, and maybe you could speak to this briefly, Teresa, but this issue of, there's always going to be more coming to fill open spots, I think is always going to be a topic of discussion. But my understanding, Teresa, is that with the services that we're providing, there is a priority system. I'm not sure what you would call it. Maybe you could articulate that just for clarity.
Hi. Actually, yes. So I appreciate that you're talking about the chronic homeless population, and that's exactly what we're trying to target, because we don't want to have future episodes or people that experience long-term homelessness. We want to make sure that we have a system in place that rapidly responds to folks that are experiencing homelessness, really hitting that definition of making sure that it's rare, brief, and non-recurring, and we can't get there until we end chronic homelessness. Is there anything else?
And my understanding, for the way our system works, they have to have been here for a period of time, or I feel like there was some priority. They can't just get off the bus and then, how does it work?
Well, the current coordinated entry system that we are implementing since June 1st, we have limited housing resources. So we are basing it on a prioritization policy. And so the limited housing resources that we have through that system, we are kind of going through, so who is the most vulnerable, and following and it is based on their vulnerability, the length of time homeless, and maybe when they were identified in the coordinated entry system as well. Yeah, so it's not really based on how long they've been in this community, but we're looking at length of time in homelessness, and we have to verify that. Yep.
Heather.
Thank you. In September, I attended the Chamber of Commerce annual banquet. And was anybody else in this room present at that by any chance?
Guess when you were.
Okay, good. All right. And we had the guest speaker was former Chief of Police of Dallas, Chief Brown. And he was a very provocative speaker. And he was on the job when they had a shooting and 5 officers went down. And it was really interesting because this was a presentation that was honoring our first responders. And so everybody, of course, pulls out their patriotic badge and wears it at an event like that. But afterwards, I asked them the question, is this the way we ought to be spending our dollars? Should we be funneling all sorts of our general fund dollars into public safety with the police? And he said, actually, no. It'd be a whole lot better if communities actually put more focus with their dollars in the supportive services and those social network safety systems so that people don't get to a point in their lifetimes where they are now becoming violent, or they are without the mental health stability, or whatever it might be that causes them panic or moments where they do something that is probably an act of just absolute disruption. And I wanted to share that with you all because this is what we're talking about. Because if we don't address this, we're going to have to spend more and more money on our police department, and they are already taxed. They are unbelievable social workers in and of themselves, but we need to support our homeless population, especially our chronic homeless population.
Thanks. Additional comments?
Hello, my name is Nate Richmond, and I wanted to come up for a couple of reasons. One is I am a business owner here in Missoula, and the second reason is that my business, Blue Line Development, is predominantly focused on developing permanent supportive housing for homeless. And I'm involved in 3 projects in Denver, which I don't know if any of those are ones that you looked at, and 1 project currently in Salt Lake City. And I've seen firsthand how successful the Housing First model is, and I think it is absolutely the right way to go here in Missoula, and I hope we can allocate some resources to make that happen.
Thank you. Yeah. Stacy.
Is there anyone in the audience who's here from the medical community? Because I don't think we've heard from them, and given the pie chart, and I don't mean to put them on the spot, but, but yes, I will.
Spot located. And I will say I saw some other representatives who were here earlier who left, so.
So I'm Karen Myers. I'm with Providence St. Patrick Hospital, actually meeting tomorrow together, so we're excited about that. I think this is a phenomenal presentation. I think it's exciting. We have always wanted to look at different models of care. We know that the right place to care for people is not the emergency room. We have to think about this differently. So I'm excited by this, and I'm excited to talk with you further tomorrow. We've been here 145 years here in Missoula. So this is our community, and we want to care well for our community and be a part of the solution. So looking forward to more tomorrow.
Thank you, Karen. I saw you raise your hand in the back. Did you want to add anything at all, or?
So my name's Cesar Bonilla, and I work for Ag Worker Health and Services off of Lolo. But I have, at the university, I major in Spanish, and I did translate and worked a lot with the Poverello Center. And I've worked with the Poverello Center as well through Ag Workers Health and Services. I translate for Spanish-speaking patients of all sorts. And I have seen that I feel like it's hard to just generalize all these homeless people into one place when they're, every situation is so different, which I do think this is very interesting and important to centralize this idea to these certain people that, maybe aren't in the general population of these homeless shelters. And I've wondered that too, going to these places, like, how can they all, go into the same protocol, or if their situations are different. And me working with the homeless and patients specifically, just trying to help them navigate through the community for patients Spanish speaking or not, I think it's awesome. I really liked the presentation and everything.
Thanks. I have a couple thoughts, and then I want to give the floor to Julie to wrap up here. I'm sensing it's probably time. First and foremost, thank you, Vanessa, for the presentation, for coming up here. Is this your first time to Missoula?
No, I was actually going to go to college here to get my master's, and then I drove down to Sun Valley and applied for a job and got it and moved there.
Wow.
Yeah, sorry.
We'll forgive you.
No, but I love it here. It's beautiful.
Yeah, I sense that there might be, there certainly is opportunity. I think I speak for all of us in wishing you the best with the opening of the facility. Follow-up data I'm really interested in. Stacy brought up, and I think Heidi did, this, the idea of the movement out, and I forget the terminology, especially the negative and the positive attrition. And I found myself having to really wrap my head around the fact that, yeah, this is not a facility where we're talking about, yep, we want them to come in and the target stay is like a month or something. And though that's sort of obvious when you start talking about it, I found myself stuck in that cycle of thinking of it as not permanent, but temporary. And then, okay, well, what's the metric that we're trying to hit? And so thanks for bringing up both aspects of that sort of attrition. I guess you mentioned several times this idea of leading out, which interestingly, it's not actually an expression I had heard, but I know what you mean by it. And this is certainly a community that leads out. And I think I've been looking for the opportunity at multiple times to say, there are other communities around the state that don't have the financial resources or the capacity to deal with some of these issues. Missoula does, even though it does strain us. And this is an example where the character of the community is such that we do lead out on this issue. And so I sometimes find myself tired of hearing about the stories of the bus tickets handed to individuals. So be it. Some people in those other communities, I'm sure, are doing that because they don't have the capacity and the resources within their community to improve that situation, both for the residents as well as for the affected individual. So, we can do that here. And I'm not going to lose any sleep at night over the idea that there are some bus tickets handed out for people to come here. In many ways, it's actually a sign of, I think, as Gwen was referring to, the compassion and character of the community. And we can do this in a way, and we can be smarter about the way that we do it, such that we're incredibly fiscally responsible in the way that we deliver care and act on our values. So with that, Julie, final note, we're going to wrap up.
I just wanted to dovetail off of what Brian said. I was meeting with the first responders during the campaign trail, and they were, voicing frustration that they seem to go on the calls for the same people in the same areas. They can't take them to jail. We don't really have anything to do with them. And I said, well, I know that we in this community are spending money on those people. It's just allocated differently in amongst everyone's budget. I think the gentleman from the Park Service gave a perfect example of that. It's, he doesn't line item out how much he spends cleaning up and, things like that. So as a community, we are spending money, and your data just quantified that those resources are already being spent on this population, and there's a way to be more fiscally responsible and improve the quality of these people's lives. So I thank you so much for, putting the hard data onto paper for us.
Okay, that was meant to be a wrap up, Jesse.
I just wanted to clarify for the record that I wasn't saying that it was good or bad if more folks did come in and fill those places. I just wanted to bring up the fact that could be a possibility. I wasn't trying to say it was good or bad, because you yourself said that you did have some protections in place that would prevent that. So I just wanted to bring that up as a possibility, not saying it was a good or bad thing. So thank you, Mr. President.
Julie, take us home.
So the math is undeniable. You can't argue with math. We can't keep expecting our hospital system to, for lack of a better word, pay for our homeless problem, and that is what the math is showing us. I think we all need to partner. The goal is to make it go away, right? The goal is for this endeavor to fail. We want to be so successful at housing people and getting them back into society, that we don't want to have this program anymore. It's just like the food bank. He wants to be out of business. So I would love for that to happen. I would love for us to go back to the 1950s where people took care of each other. I want Missoula to be that place. I think Missoula is that place, and I think that this is just one more tool that we have to do that. I don't know what the heck is going on with the rest of the country, but that's not us, and that's not the path I want us to be on. And we can talk about this all day long, but it comes down to the math. The math is undeniable. It is cheaper to house people than it is to have them on the street, and I hope that this is the beginning of the conversation where we put those tools in place. And I want to stress again, this data is from Boise, and Erin does not yet have all the data from Missoula. She has got the grant for that study, and they will be working on that in the next year, and she will have the numbers, and let's hope they're not higher than this. Let's hope that these costs are not higher than we're seeing now, but what we're seeing is we can save our taxpayers money, we can save our businesses money, we can put more money back into the economy by putting people in houses. So I hope that's the takeaway for everybody here.
Thanks. You had me at math. All right, we're adjourned.